So now we continue with the approach to omitting, and we will look into another important case now. And this is case number 5. So carefully read this case now. Okay, so a 4-year-old child presented with omitting for last 3 months. Okay, now this is a elder child, 4-year-old child is presented with the omitting for last 3 months. And omitting is there. On direct questioning, there will be lethargy. There will be lethargy. In the last case, if you are seeing in the case number 4, child is having irritability. That irritability is also because of this toxic metabolite substances irritating the neuron. Okay, so that's the reason why there is irritability. Anyway, so in this case, the first 4-year-old child presented with omitting for last 3 months. On direct questioning, there will be lethargy. Yes, child is very dull, lethargic, always sleeping like that. And there is also loss of weight, but there is no other symptoms. These are the only 2 symptoms. One is vomiting since last 3 months, then there is lethargy, then there is loss of weight. Now the physical examination showed normal. There is nothing special in physical examination. And we have done all the routine test, and all the routine test also shows the normal. Okay. Only one thing is increased, that is serum sodium. Serum sodium is 124 and potassium is 5.3. Now we know that 130 to 140, the serum sodium level is normal. Okay, if it is somewhere around below 130, usually we will consider it as a hyponatric dehydration, like hyponatremia. But of course 120 to 140, that borderline is there for the serum sodium level. Here serum sodium is 124, but potassium is greatly increased. Potassium is anything more than 4 is not normal for potassium. Now, potassium is 5.3. When you go for the serum electrolyte, we find these 2 variations, except that everything is fine. Child is having omitting, child is having lethargy, and child is having loss of weight. And after this, after few days, then again he developed some of the neurological symptoms. Okay, previously he has got lethargy and loss of weight and other symptoms. Now sodium is 124 and potassium is 5.3, and now he developed some of the neurological symptoms. So what is that? We will see. Now he developed some of the neurological symptoms. So this is a case. Okay, now we have to look into the anatomy of the omitting in this particular case. So we know that omitting can occur because of 3 important groups. One is GIT. Omitting may be because of GIT problem, where the chemoreceptor trigger zone is get stimulated. Omitting may be because of the renal problems, as we have seen in the last case, because of the irritation of the omitting center by the retained metabolic waste products. And another is omitting may be because of autonomic nervous system stimulation. Okay, omitting may be related to autonomic nervous system, omitting may be related to the renal, omitting may be related to GIT, like that. Now in this case, this is not GIT. Okay, in this case there is no GIT because history is not suggestive of such thing. But it can be because of the CTZ or renal. It may be because of a chemoreceptor trigger zone problem related to renal system, as we have seen in the last case. Or it may be because of autonomic nervous system. Okay. In this case, if you see, there is no polyuria. There is no polyuria. So therefore, there is no renal cause. So renal cause is excluded. In the last case, there was a polyuria that made us to think about the renal problem. But here there is no polyuria. So there is no renal cause. Here there is no any other GIT disturbances. Only omitting is there. That means omitting is not with the nausea and all those things. So it is not even GIT. Now what is left is autonomic nervous system. So is it a autonomic nervous system problem? That we have to confirm. Now, what do you mean by autonomic nervous system? Is a autonomic nervous system neurotransmitter is adrenaline. We know that, isn't it? So autonomic nervous system, sympathetic and parasympathetic. In the sympathetic, always the post-ganglionic, pre-ganglionic is I think acetylcholine, but post-ganglionic is always adrenaline neurotransmitter. Okay, So autonomic nervous system, if you take the sympathetic nervous system, the neurotransmitter is adrenaline, and we know that this adrenaline is secreted by adrenal gland. Okay, and we also know that the secretion of the adrenaline is maximum during the time of the stress. Whenever there is a stress, there is more production of the adrenaline. We know that. Okay, this is one of the catecholamines. Okay, for example, in case of acute myocarditis or myocardial ischemia, excess contraction, usually patient will have vomiting, and that vomiting is because of the stress actually. Okay, so that is because of stress. What I mean to say that whenever you have got a lot of stress, then there will be loss of production of adrenaline and there may be vomiting. But how it is, we will see that. Now, in this particular case, it is due to the involvement of the autonomic nervous system, because G8 is excluded and renal is excluded. So only possibility what we have left with is the autonomic nervous system. Okay. But actually this is a 4-year-old child. There is nothing like that kind. There is no stress factor and there is no such problems. Nothing is there. But how come we can attribute this particular vomiting to the autonomic nervous system? Okay. Now we put another question, that is another important symptom in this case is lethargy. Okay. Now do you think any adrenaline problem can lead to lethargy? Lethargy may be because of hypoglycemia. Lethargy may be seen in case of hypoxia. Okay, lethargy may be seen in a hypovolemic shock. Okay, or lethargy may be also seen in case of hypernatremia. We can find in case of hypernatremic dehydration, isn't it? The lethargy will be there. Now, out of these, hypoglycemia, hypoxia, hypovolemia, hyponatremia, etc., which is related to the adrenal gland? Hypoglycemia, it is not related to adrenal gland. Hypoxia, no. Hypovolemia, no, it is related to fluid and blood. Hypernatremia, yes. Hypernatremia may lead to lethargy because, and it has got its relationship with the adrenal gland, because in the adrenal gland we know that medulla secretes 3 important hormones. I think cortex produces 3 important hormones: mineralocorticoid, corticoids and androgens. These mineralocorticoids are very important to maintain the sodium balance in the body. Mineralocorticoids, name itself is called as mineralocorticoids. So that is very important to maintain the sodium balance in the body. So it is hyponatremia or hypernatremia. Okay, because mineralocorticoids are produced from the adrenal gland. Now, so a adrenal gland may also cause vomiting and may also cause lethargy. Okay, because we know that autonomic nervous system, whenever the stress is increased like conditions, there will be vomiting. That is because of the adrenaline secretions. And same adrenal gland problems can also cause lethargy also, because lethargy can be seen in case of a hypernatremia. Okay, so sodium, just make a correction here, 124, isn't it? 124, sodium is 124. That means usually, as I told, this is the lower side actually. Okay, 130 to 140 usually considered as normal. 124 means it is relatively towards the lower side. So here, as I told, it is not a hypernatremia, it is a hyponatremia. Okay, so isn't it? Have you seen the case? I will go back again if you want to see. See, here the child is having 124 sodium is, potassium is slightly increased, it is on the lower side. Okay, now we know that sodium can cause this particular problem. Hyponatremia also leads to lethargy, hypernatremia also leads to lethargy. Okay, so this being the case, now the adrenal gland may cause vomiting and also it may cause lethargy if the sodium is decreased. And in this case what happens, sodium is decreased and in relation to that relatively the potassium is increased. यहाँ पे क्या हुआ कि सोडियम का अमाउंट कम हो गया, तो इसकी वजह से जो है बैलेंस बिगड़ गया और इसका रिलेशनशिप में जो है पोटासियम का लेवल बढ़ गया. ठीक है, सो दैट इज वेरी क्लियरली सीन ऑन इन्वेस्टिगेशन. 124 sodium and 5.4 is potassium. So problem is there with the adrenal gland. So this particular adrenal gland problem actually causing the vomiting and also causing the lethargy, which are the two important symptoms in this case. Okay, presentation in this case. Now let us see further what happens. Okay, do you find any conditions where this particular problem is there? Okay, so प्रॉब्लम जो पैथोलॉजी अब रिलेटेड टू कहाँ पे हो गया, एड्रिनल ग्लैंड का हो गया. सो छोटा बच्चा है 4 महीने का, 4 साल का, तो उसमें एड्रिनल ग्लैंड का प्रॉब्लम क्या हो सकता है? देयर इज ए कंडीशन कॉल्ड एज एड्रिनल ल्यूकोडिस्ट्रोफी. एड्रिनल ल्यूकोडिस्ट्रोफी. सो वी हैव वन केस इन द IPD, आई थिंक यू नो दैट इज ओनली ल्यूकोडिस्ट्रोफी. ओनली ल्यूकोडिस्ट्रोफी इज रिलेटेड टू द ब्रेन एंड मोटर ट्रैक्ट्स एंड ऑल. ठीक है, वाइट मैटर का प्रॉब्लम है. और उसके साथ साथ जो है ल्यूकोडिस्ट्रोफी, कभी कभी एड्रिनल ग्लैंड भी इफेक्ट हो सकता है, बिकॉज एड्रिनल ग्लैंड इज ऑल्सो कंसिडर एज वन ऑफ सिंपैथेटिक गैंग्लियन है. ठीक है, सिंपैथेटिक गैंग्लियन है. तो सिंपैथेटिक नर्व्स है, सिंपैथेटिक नर्व्स भी क्या है, वो भी ट्रैक्स है, वो भी एक्चुअली वाइट मैटर में ही आता है. समझ रहे हैं ना कि सेंसरी ट्रैक्ट्स और मोटर ट्रैक्ट्स और इवन सिंपैथेटिक नर्व फाइबर्स, दे आर एक्चुअली कम्स अंडर द वाइट मैटर ओनली, बिकॉज एवरीथिंग इज ट्रैक्स. ओके, so there is a condition called as adrenal leukodystrophy. सिर्फ ल्यूकोडिस्ट्रोफी है तो वो नर्व सिस्टम से रिलेटेड है, एड्रिनल है तो नर्व सिस्टम के साथ एड्रिनल ग्लैंड भी अफेक्टेड है. तो उस कंडीशन में आप देखेंगे तो कुछ एड्रिनल सिम्टम्स मिलेगा. पेशेंट का जो है ब्लैकिश डिस्कलरेशन ऑफ द पाम्स एंड लोअर लिम्स, अपर लिम्स, ये सब मिलेगा, क्योंकि वो एड्रिनल ग्लैंड का प्रॉब्लम है. वी विल सी दैट नाउअडेज एक्वायर्ड एड्रेनलिन डिसऑर्डर्स आर एक्सट्रीमली रेयर. And even the adrenal hemorrhage and sepsis is also rare, of course. So adrenal tuberculosis is also very rare. So in this particular age group, 4 to 5 years, extremely common is adrenal leukodystrophy. देखो यहाँ पे इस एज ग्रुप में जो एड्रिनल ग्लैंड का दूसरा जो प्रॉब्लम आ सकता है वो क्या है कि एक्वायर्ड एड्रिनल ग्लैंड डिसऑर्डर्स, वो इस एज ग्रुप में कम है. या तो होना चाहिए एड्रिनल ट्यूबरकुलोसिस लाइक कंडीशन, वो भी इस ग्रुप में कम है. तो फिर क्यों एड्रिनल ग्लैंड का फंक्शन कम हो गया यहाँ पे? हाइपोनेट्रीमिया क्यों होगा? हाइपोनेट्रीमिया हुआ इसका मतलब एड्रिनल ग्लैंड का कॉर्टेक्स के जो मिनरलोकॉर्टिकॉइड जो हार्मोन प्रोड्यूस हो रहा था उसका प्रोडक्शन नहीं हुआ, मतलब एड्रिनल ग्लैंड में एट्रोफी हुआ या डिस्ट्रोफी हुआ. ठीक है, तो वहाँ पे जो है वो एक ग्लैंड को, ये हार्मोन को प्रोड्यूस करने वाला लेयर हट गया, डिस्ट्रॉय हो गया. क्यों डिस्ट्रॉय हो गया, क्यों डिजेनरेशन हुआ? द पॉसिबिलिटीज leukodystrophy, adrenal leukodystrophy. So this is actually a case of adrenal leukodystrophy, which is quite common in 4 to 5 years of age. So now if you look into, see these are the pictures, हाथ में जो blackish discoloration आता है, hair changes जो आता है, ठीक है, and this is a picture of adrenal leukodystrophy. Okay, so this is a very special case. Patient, if you see patient presentation is 4-year-old child presented with vomiting for last 3 months. Again, up to 3 months back. ठीक है, 3 महीना 3 साल और 10 महीने तक उसको कोई प्रॉब्लम नहीं था और उसके बाद प्रॉब्लम शुरू हो गया. That means when the adrenal glands is get affected, डिजेनरेशन होते होते जब एड्रिनल ग्लैंड तक वो आ गया तो एड्रिनल ग्लैंड का अफेक्शन शुरू हो गया, एंड एज अ रिजल्ट देयर इज वोमिटिंग एंड एज वेल एज देयर इज लेथार्जी. सो लेथार्जी जो एक बहुत टिपिकल पॉइंट है, मैंने हमेशा बताया, इरिटेबिलिटी, लेथार्जी, डेलीरियम, ये सब बहुत टिपिकल सिम्टम्स होता है. इसको हमेशा आपको सीरियसली देखना पड़ता है, उसी से क्लू मिलता है. सो दिस इज अनदर इंपॉर्टेंट केस रिलेटेड टू vomiting. So now we will go into the another case related to vomiting.